Hi, my name's Bill Bahnfleth. I'm a mechanical engineer and professor of architectural engineering. My teaching, research, and service focus on raising awareness of the importance of indoor air quality, IAQ, to human health and well-being, and developing sustainable ways to provide excellent IAQ in all buildings. Pure air is about 99% nitrogen and oxygen, with traces of other components like carbon dioxide. Contaminants that degrade IAQ include fine particles, gases, and bioaerosols, some from outdoors and others of indoor origin. They can cause infectious diseases, respiratory diseases, and cancer, trigger asthma attacks, and impact work performance, cognitive function, and sleep quality. Outdoor sources include fossil fuel combustion for transportation and industry, and events like wildfires and other natural sources. The main outdoor contaminants of concern are fine particles, ozone, nitrogen oxides, and radon, all of which can find their way indoors. Indoors, sources include occupants, building materials, combustion for heating and cooking, candles, air, fresheners, and many others. Important indoor contaminants include fine particles, organic compounds from building materials and furnishings, nitrogen dioxide from natural gas combustion, and carbon monoxide from malfunctioning combustion equipment. Overall, levels of contaminants indoors tend to be much higher than they are outdoors. The best way to protect ourselves from indoor exposures is source control, eliminating the hazard whenever possible. For example, subslab depressurization effectively prevents radon from entering a home. When a hazard can't be eliminated, engineering controls, ventilation, filtration, and air cleaning are the next line of defense. Ventilation with outdoor air to dilute and remove indoor contaminants is a centuries-old practice. However, heating, cooling, and humidification of outdoor air is energy intensive, and outdoor air can be very contaminated. Increasingly, air cleaners for particles, gases, and infectious aerosols are being used as alternatives to increasing outdoor air. There's ample evidence that ventilation and air cleaning can significantly improve indoor air quality. For example, Wells et al. Demonstrated nearly a century ago that germicidal ultraviolet light could greatly reduce airborne infection rates. In one notable case, weekly new measles cases were reduced from a peak of nearly 25% in untreated classrooms to less than 5% in classrooms with UV. Recent studies of the effect of IAQ on school performance by Vargoshki et al. Showed that increasing classroom ventilation increased speed on tasks by more than 10%, reduced error rates significantly, and correlated with reduced absenteeism. Indoor air quality is a complex and broad subject, but resources are available to help both the public and professionals learn what they need to know. The web pages of the U.S. Environmental Protection Agency and ASHRAE's position documents and IAQ standards are a great place to start. Knowing how much is to be gained and armed with essential knowledge about IAQ controls, each of us can start today to make our home and work environments safer and healthier.